Hello, everyone, and welcome to this week's Culture Report. I'm Antonia Velez. We have a good mix of content for you this week, but we want to start with conversations about autism. It's Autism Awareness Month, and though we should always tell the stories of neurodivergent folks and people of all abilities, we want to focus on this community a little more this episode. 1 in 31 children in the U.S. will be diagnosed with an autism spectrum disorder by their 8th birthday. That's according to a new CDC report that also shows a sharp rise in autism over the past 2 decades. In a statement Tuesday, Health and Human Services Secretary Robert F. Kennedy Jr. said, quote, "The autism epidemic has now reached a scale unprecedented in human history. But many doctors are taking issue with that interpretation, saying the rise is because of better recognition and awareness, meaning the same number of kids likely have autism, but now more of them are being correctly diagnosed." And in recent years, we've seen more and more representations of autism in the media, from shows to movies to docuseries. But just like everything else, this can have pros and cons. You've probably heard of Love on the Spectrum, a Netflix reality show that brings viewers along as individuals with autism navigate dating. I sat down with Kaelynn Partlow, a season 1 participant, autism advocate, and author, about her experience on the show, the representation of autism across mediums, and how social media helps amplify neurodivergent voices.
With, social media, anyone and everyone can participate, which is both beautiful and a little bit frustrating at times. So everyone has the opportunity to tell their own story. Unfortunately, just the way social media works, the audience kind of decides whose stories get to be heard.
What was your time like on Love on the Spectrum? How did you find out about it? What compelled you to participate? Anything that you want to share about it?
It really wasn't that incredible of a story. I watched the Australian version. I thought it was fantastic. I sent an email, I did a couple of Zoom interviews, and things just moved very, very quickly. When people ask how it felt, typically I describe it as feeling sweaty, because you get nervous and your armpits start to sweat, and it was a very sweaty experience, but that doesn't mean it wasn't worth it. There were certainly parts that were challenging because you get thrown into new circumstances, you're meeting new people, you've got a camera crew in your bedroom asking you very personal questions. But I don't know, I was just kind of along for the ride, I guess.
There's an ongoing debate online about whether the show is like quote unquote exploitative for neurodivergent or autistic folks, or a good representation of the community.
They told us, this is not a paid opportunity. This is participation in a docuseries. And as such, there is no compensation for that. And everybody was okay with it. And then in terms of representation, my thought has always been that when you gather a group of, say, 10 or so people, you're not going to hope that those 10 or so people are going to accurately reflect all the possibilities within one big group of people. And I think with more seasons being filmed, they'll be able to add more diverse perspectives. And additionally, on top of that, I also kind of think it will inspire more filmmakers to explore this area of neurodiversity and inspire people to make more, pieces of media surrounding autism.
I think traditionally, we all know there's been little to no media representation of people on the spectrum. And when there is, folks have often, been misrepresented or stereotyped. What do you think, as someone who has autism, do you think there's been any progress in recent years? What do you think is the biggest misrepresentation or something that people usually get wrong when they're portraying people on the spectrum?
I would say that progress in recent years has certainly been made, but I think at this point, it's more about quantity than it is about quality. I think quality will come, but quantity has to be first. And I guess to answer that last part of your question, I kind of believe that the genius stereotype is way, way overdone. We've got Sheldon Cooper, we've got the good doctor, we've got Rain Man. And the unfortunate part about that is only about 10% of autistic people are said to have an advanced IQ. So I talk a lot on my social media about folks with profound autism, which is a distinction being made with people who are, traditionally what they would say as more on the severe end of the spectrum. And with a co-occurring intellectual disability, so IQ less than 50. These are folks who cannot speak for themselves. And so I would say in an ideal world, we tell those stories. Those are stories that are both not told by themselves and are just not told, period. There are some harsh realities that can accompany an autism diagnosis, whether you have high support needs or low support needs. And I think it would be important to kind of see those brought to life in a respectful way.
I'm curious to hear what you think about what the role has been that social media has played in shaping like public perception of autism and neurodivergent folks?
I think it's been a mix. With, social media, anyone and everyone can participate, which is both beautiful and a little bit frustrating at times. So everyone has the opportunity to tell their own story. Unfortunately, just the way social media works, the audience kind of decides whose stories get to be heard. And so by nature of that, the algorithms are going to kind of naturally select the more simplistic and less nuanced pieces of content that float around about autism. But the flip side of that is, like I was saying earlier, people whose stories are historically not told are having the chance to be seen and heard for the first time. I've got content that kind of fits into two frameworks. The first one being awareness. A lot of times I'll talk about an issue that pertains to the autism community that I feel is not spoken about enough or is not widely understood. The other kind of facet that my social media kind of goes down is the actionable one, where I'm giving them in the moment tools and strategies that they can use, like I said, in the moment, to kind of help somebody either move on from perseverating or to help them cope with change or to help them deal with a meltdown.
That's awesome. And I think that it's really cool that now with social media, so many people can get access to these things, can watch these videos. Tell me about your book, because that's a really, really big deal.
It's the book that professionals in 2007 told my parents I would never be able to read, much less write, and it was published last September. The reason for writing the book was that I had spent the better part of the last 2 or 3 years creating all this content, all this information, so I decided to put it all in a book, so it's all in one place, and it's available on Amazon, it's available on Barnes & Noble online, and I think some libraries are carrying it as well. The title of my book being Life on the Bridge, it reflects my goal in that I am hoping to be a bridge between the worlds of autistic people and those who support us. And with my content, I'm kind of hoping that I can create other bridges out there in the autism community that other people will also feel compelled, if they desire to kind of go down this path, to bridge our worlds together, because we're more alike than we are different. And it's just a matter of organizing information in an accessible way.
All right, and when people think about autism, they often think about the perceived difficulties that come with being neurodivergent, without also acknowledging the positive opportunities and experiences that autistic people are able to have. We brought together 4 organizations in Denver that focus on providing resources to enhance the lives of those with autism through work, education, travel, and therapy, to gain a better understanding of why certain opportunities some of us take for granted can make such a difference in the lives of others. All right, thank you so much for everyone being here today. I want to start with just hearing from you. Tell us a little bit about yourselves, the organizations that you're part of, and what services your organizations provide.
My name is Maureen Welch, and I have Navigating Disability Colorado, and we're the only company in Colorado that has a step-by-step online program in community to help people access resources like Colorado Medicaid waivers, to enroll and then to maximize their services.
I'm Dr. Amanda Kelly, and I'm the CEO of Firefly Autism, and Firefly Autism is a nonprofit organization. We've been around for 22 years and provide a whole host of supports and services for individuals on the autism spectrum of all ages.
Hi, my name is Katerina Hewing. I'm the Executive Director at Dirt Coffee. We are a nonprofit social enterprise that is focused on working with neurodivergent job seekers. So we offer paid internships within our cafe. We also do job development in the community, finding jobs that are integrated, competitive, and that they're passionate about. And then last, we work with employers on their disability hiring practices as well.
My name is Jenna Cordacious, and I'm the founder of the Traveling Gnomes. We design and lead different travel opportunities for individuals with disabilities, both locally and globally, through our extended day trips and overnight adventures. And this is one of our most seasoned travelers.
Paul Clifford, participant for Traveling Gnomes.
That's awesome. Well, these are all such important things. Why is it so important that these resources are provided? And, what have you seen the impact to be on the lives of the people that you work with?
I guess what I've seen is there's a lot of siloing of services.
Yes.
Like you have education in one area, you have employment in another area, you have Medicaid, you have medical, and they're all separate, and they don't necessarily make it easy to communicate even between. Like I have physicians that call me for information because they don't understand how Medicaid in the application process works. So I even have one member in our community, we have 400 members in our online free community, who said that she's adopted 4 children overseas from many different countries. And those 4 adoptions together were easier than doing one Medicaid application for the waiver services in Colorado. So it's just very complex. So many people touch the applications and paper. There's a lot of human error that happens during that process. So I think when you bring people together, and also when we network amongst each other, we realize that together we can support each other, and often the solutions come from within our community more than from the systems that exist to serve our community.
Absolutely. I think that's so important.
And if I could add to that as well, I think about every week, and today is actually a really good example. Today I got 2 emails from 2 individuals in our community who said, you know, hey, my next door neighbour just received a diagnosis for their child. They're reeling. They don't know what to do. They don't know where to go. Can you help? And to be able to connect resources for people, whether it be, you know, across a variety of abilities, right? Because every single individual is so unique, and there's a really broad variety of abilities. No one organization can do everything. So it is really important to make sure that we know one another, we network with one another, we know what the other person does. And you can pick up the phone real fast. I mean, those 2 phone calls today were less than 5 minutes, but it really helped people get on the journey to knowing what they need, you know, whether it's a diagnosis, whether it's navigating a Medicaid application, whether it's a transition to work. I just think it's so key. And where families really struggle is when they cannot find the resources that they need. They're stuck and they feel helpless, they feel hopeless, and they feel like they can't get their child what they need. And it's just not where you would want to be as a parent.
And also very isolated. I think a lot
Yes.
of our community is isolated. When you can make those connections, they realize they're not alone. And that just makes your heart feel more at peace, even though you're struggling.
And that they have the fact that they can pick up the phone and give us a call. We just recently had a call from a parent who was in tears because they had been told that their son would never work. And we were like, that's not true. You know, we were like, bring him down. Let's meet him. Let's talk to him, you know. And she just, in that moment, she thanked us, you know. And I think that we know that a lot of people are getting that news or have those assumptions or those misconceptions built in of what our community is capable of. So I think that's one thing that we are going up against every day.
Right.
With me on the vocational side and like looking to offer folks the training and the pathway into employment, I also am seeing with employers that they might have the willingness to hire, but they're not ready to support neurodivergent folks yet. And I think that there is a lot of growth needed there and a lot of training, but that's also an amazing thing that we're seeing a lot of that opportunity. We are seeing employers wanting to diversify their workforce engagement and also supports here in Colorado for employers to do so. So we get to meet everybody, you know, from the parents to the job seekers to the employers, which necessarily is like our entire community gets touched by this every day.
Specific to inclusive travel, travel sparks curiosity. It sparks new conversations, new experiences, new adventures that then carry over into just everyday life. And I feel like everyone deserves that chance to experience the joy of adventure.
Absolutely. Yeah.
I've been on overnight trips with the group. I've been to trips in and around Colorado, Wyoming, and other places.
That's awesome. Do you enjoy them? What do they bring to your life?
Independence and growth, among other things.
I'm so glad that there's progress being made. Of course, there's a lot of work to do, but organizations like the ones that y'all take part in are doing that. Is there anything else that you think is important to highlight when it comes to the conversation about, you know, giving neurodivergent folks a seat at the table and providing them with the services that they need? Anything you think is important?
Yeah, I'll jump in here. I think that for decades, people have been underestimated. And I'm grateful to see that there is growth through education and training, but I still think that there's a lot of underestimating of what individuals, neurodivergent individuals, you know, can do. And there's still a lot of kind of miscommunication and misunderstanding. And the more that we can educate, the more that we can have the individuals' voices in the room, the more that we can show through a broad variety of education platforms what neurodiversity is and what neurodivergent individuals bring to workplaces, to communities, I think that's really going to push the needle forward.
Yeah. I think that really goes to the point that every single person is different,
Right.
and has different strengths and different supports of need, and that even for our community looking for, if one thing didn't work out for you, try another thing. I think that it's just like having the courage to keep showing up and finding what's right for you, finding the right organization, the right fit for how do you want to travel, the world, and how do you want to engage with resources and find the support that you need, and just, not closing the door on that.
Totally. Paul, is there anything that you want to add about your experience with traveling gnomes or otherwise?
Well, basically, I've enjoyed being with the group and traveling along and been to different states I haven't been to. Last year, for instance, I went to Oregon for the first time, went to Washington State for the first time, and last year I went to LA for the first time since 1986, and I enjoyed that a lot. I go back. Yep.
I'm so glad to hear. Well, thanks everyone for being here today and taking time out of your busy schedules to join us and share your experiences and knowledge. We really, really appreciate it. Thank you.
Thank you.
A federal judge announced that he's found probable cause to hold the Trump administration in criminal contempt of court for not obeying his order to reverse the flights that took deportees to El Salvador last month. U.S. District Judge James Boasberg ordered the planes to turn around shortly after Trump invoked the centuries-old Alien Enemies Act to deport more than 200 Venezuelans with alleged gang ties, accusations that some have claimed are untrue. Boasberg said the administration could reverse his contempt finding by giving those people hearings so they can challenge the allegations made against them. And last episode, we told you about Kilmar Abrego Garcia, a Maryland father of 3 who was put on one of those flights to Central America by mistake. At the end of March, the Justice Department said Abrego Garcia was deported to El Salvador due to a, quote, administrative error, despite a Supreme Court ruling that says the government must facilitate his release. El Salvador President Nayib Bukele and Trump advisors have said they have no way of returning him. A federal judge said the refusal to bring Abrego Garcia back is a clear defiance of the Supreme Court and ordered sworn testimony by 4 officials to see whether anything has been done to coordinate his return to the U.S. Outside that court hearing, his wife spoke directly to both countries' leaders.
I will not stop fighting until I see my husband alive. Kilmar, if you can hear me, stay strong. My heart aches for my husband, who should have been here leading our Easter prayers. Instead, I find myself pleading with the Trump administration and the Bukele administration to stop playing political games with the life of Kilmar.
Now, the Trump administration is continuing its visa crackdown across higher ed educations in the U.S. Hundreds of students have had their visas revoked, and many say they have not been given a clear reason why. Attorneys and advocates tell NBC that in addition to people who have been previously arrested, those with certain political social media posts and those who have participated in pro-Palestinian protests are the likeliest to have been targeted. The president has referred to pro-Palestinian student advocates as terrorist sympathizers and called the demonstrations, quote, anti-Semitic. And the Trump administration says its fight against anti-Semitism is also part of the reason it will pull millions in funds from universities. The government announced it would freeze more than $2 billion in grants to Harvard after the school refused to comply with demands to limit activism on campus. Those demands include things like restricting the acceptance of international students who are, quote, hostile to American values and institutions, and auditing students' views on diversity. Funding has also been paused for other prestigious universities. And some Jewish organizations in the U.S. have applauded the Trump administration's moves. Others have publicly expressed their disagreement, saying their experiences are being used to further a political agenda. In a joint statement issued Tuesday, a coalition of 10 Jewish organizations said they believe anti-Semitism has become increasingly normalized and requires action, but criticized what they called, quote, the false choice between confronting anti-Semitism and upholding democracy. It's the comeback no one asked for. As of last week, the Centers for Disease Control and Prevention had confirmed more than 700 measles cases in 25 states. This comes as vaccine skepticism continues to rise and vaccination levels continue to drop. During the 2011-2012 school year, 94.7% of kindergartners had received the MMR vaccine. The rate was the same in the 2018-2019 school year, right before the COVID-19 pandemic. Last year, the vaccination rate dropped 2% to 92.7%. We're seeing a similar pattern with other vaccines. For the Tdap vaccine, the vaccination rate went from 95% in 2011-2012 to 94.9% right before the pandemic to 92.3% for the 2023-2024 school year. Just over 96% of kindergartners had gotten at least one dose of the chickenpox vaccine in both the 2011-2012 and 2018-2019 school years. In the 2023-2024 school year, the vaccination rate went down to 93.7%. According to the Colorado Department of Public Health and Environment, when 95% of people in a community are protected from a disease either through vaccination or previous infection, most people are protected through herd immunity. Now, for years, one of the reasons why some people have been hesitant to vaccinate their children is because of a discredited study claiming vaccines cause autism. We want to be clear, there is scientific consensus that childhood vaccines don't cause autism. And with vaccine hesitancy on the rise and the reemergence of highly contagious but vaccine-preventable diseases like measles, more pediatricians are drawing a hard line in the sand. 9 News reporter Jennifer Meckles talked to one of them, Dr. Michael Milowski, about why he chooses to enforce vaccine policy at his Castle Rock office.
I opened our office about 11 years ago. I'd say about 3 to 4 years into opening that office, it became clear that this was necessary. We had an infant contract whooping cough, clearly contracting it from our office. It was clearly an exposure that occurred in our practice, and that infant ended up being in the ICU and was extremely sick. And that was, for me, the big eye-opener. When people come in with these views, it's generally a fixed view. They felt that they have done their research, they felt that they have gathered all the available information, and they're really not interested in what I have to say. Those conversations are more and more dead ends. I find them to be more and more frustrating. I also feel, still very strongly, as a parent of 7 of children of my own, people should be provided the opportunity to have autonomy and free choice. I am not here to coerce anybody, but I'm definitely not changing anybody's minds. When you're a pediatrician, you bear a heavy responsibility for everybody that walks into your office. And unvaccinated families, especially families that refuse vaccines like whooping cough and measles and chickenpox, can represent a threat, a dangerous threat to very young children who are young to be vaccinated, medically fragile patients who have significant medical complications and for those reasons can't be vaccinated, and for whom these viruses can be way more dangerous should they be transmitted and in the office. And I cannot allow our office to be a place where that can happen.
And the 2025 WNBA draft came and went, marking several well-deserved wins, but not for Texas Christian University player Sedona Prince. Despite having finished her 7th season in college basketball, she was not one of the 38 names drafted. In fact, she was not even invited to attend the event in person, according to Page 6. This comes after at least 4 women accused Prince of sexual assault or intimate partner violence, ESPN reports. Some of these allegations went viral on TikTok after former partners of Prince's shared their stories. Prince denied allegations months ago, and now her attorney is echoing that denial this week. And a trip to space featuring a star-studded female crew, including Katy Perry, Gayle King, and Lauren Sanchez, has received backlash on social media for what some users believe was an unnecessary, planet-destroying foray into space tourism. After coming down from Blue Origin's roughly 10-minute-long, $28 million flight, Katy Perry was seen kissing the ground and saying that, quote, "We have to protect our mother," a choice that's been widely criticized because of the mission's perceived carbon footprint. And for the first time in history, a trans woman has a top 10 album in the US. Ethel Cain is the first out artist to achieve this thanks to her debut album, Preacher's Daughter. The critically acclaimed album achieved a top 10 spot on the Billboard 200 following its final release. 3 years after the album originally came out. Now, I'm a big Ethel girl myself. I've seen her live twice, no big. So to me, this should have happened in 2022. I guess people have better taste now than they did back then. But here's to hoping Ethel and other queer artists keep getting the flowers they deserve. And good news is good news, even if it's a little late. Let's get into some more of that. We have some wild good news for you this week. The 2 oldest residents of the Philadelphia Zoo are brand new parents for the first time. Mommy and Abrazo are Western Santa Cruz Galapagos tortoises and are estimated to be around 100 years old. Mommy is the oldest first-time mom of her species at any U.S. zoo. She's been at the Philadelphia Zoo since 1932. Abrazo joined the zoo in 2020. The 4 hatchlings aren't available to see yet, but are eating and growing appropriately, the zoo said. The animal care team is also monitoring more eggs that could hatch in the upcoming weeks. And scientists have resurrected the dire wolf, or the modern-day version of it at least. Colossal Biosciences recreated the once-extinct dire wolf. The de-extinction company said the birth of 3 dire wolves marks the world's first successful de-extinction, as the wolves have been extinct for more than 12,500 years. Scientists took DNA from 13,000-year-old tooth and a 72,000-year-old skull to make the healthy dire wolf puppies, who are between 3 and 6 months old. Now for news under the sea, an international team of scientists and crew on board the Schmidt Ocean Institute's research vessel have been the first to film the colossal squid swimming in its natural environment since it was identified a century ago. The sighting happened on March 9th near the South Sandwich Islands. According to a scientific expert, for the past 100 years, humans have mainly encountered the squid as prey remains in whales and seabirds. Thank you so much for watching this week's Culture Report. We'll be back to continue the conversation right here on 9 News Plus and on 9news.com.